The Maxislide is a unique, ergonomically designed device having ultra-low friction properties, which will aid caregivers in moving or positioning patients while, at the same time, encouraging good posture without causing undue stress to either the patient or the caregiver. The Maxislide will also encourage patients to help themselves whenever possible. There are 3 different sizes of Maxislide. Purple is the standard width, blue is 1.5 times the standard width, while orange is 2 times the standard width. The combination of 2 Maxislide sheets reduces the friction when repositioning patients. The sheet should be prepared with the stitched handles facing up and down for accessibility and ease of use. Maxislides may be used directly under the patient, under a sheet, or under a pad dependent on facility protocol. Prior to using the Maxislides, they need to be placed beneath the patient. Once the correct size is chosen, work with another caregiver to log roll your patient and place the sheets under the patient. If the patient is too tall for the Maxislides alone, an orange mini tube should be placed beneath the patient's heels to avoid shearing and help with the repositioning. Some patients may not be suitable for rolling, for example, when they are in pain or due to their size. In this instance, the unraveling technique may be used to insert 2 full-length Maxislide sheets. Place both Maxislide sheets together lengthwise. Fold the 2 Maxislide sheets into 6 to 8 inch folds and then turn them over so that the folds are underneath. Hold both Maxislide sheets with your outside hand to secure them, and, with the inside hand palm up, unravel each fold, taking care to keep your hand in contact with the bed. Do not lift upwards. Unraveling the folds of the sheets away from the patient prevents skin shear. It is recommended that you unravel the Maxislide sheets from the patient's head downwards, as this follows the direction of the patient's clothes or gown and helps prevent the sheets from getting caught. In case of pressure-relieving mattresses, gently push down on the mattress to assist with fitting. You may also find it helpful to set the mattress pressure to a firm setting for the procedure. Again, if the patient is too tall for the Maxislides alone, an orange mini tube should be placed beneath the patient's heels to avoid shearing and help with the repositioning. The following techniques can be used to slide the patient back toward the head end of the bed. This technique may be used when the bed is at a low height. Therefore, a pulling action is desirable. The Maxislide sheets and tube have been placed beneath the patient to remove any shearing effects of the movement. In order of preference, the methods for assisting up in bed are: 1. Clear the Maxislides from under the patient's feet and ask the patient to bend their legs and push themselves up. 2. Use the bed's Trendelenburg function to facilitate sliding up in bed. 3. Each caregiver stands on either side of the bed and holds the top Maxislide with the hand closest to the bed. Ensuring good communication, the caregivers move simultaneously backwards to the head of the bed. 4. The same caregivers can also communicate and glide sideways to adjust the patient upward. In all cases, care must be taken that the pulling action is not carried out too quickly, as this may result in injury to the patient. A pillow may be placed at the head of the bed for safety. Maxislides are removed one at a time, with the bottom one being removed first. The sheet is removed by holding the handle closest to the patient's head and pulling the sheet out as you walk down the bed. The top sheet is removed by reaching under the patient and grasping the opposite side handle and pulling the sheet under itself to prevent any skin shearing. When needing to turn a patient, ensure the Maxislides are under the patient and prepare the patient to turn to the side desired. Allow space to turn the patient onto her side. At this point, the bed is lowered, as the physical action to be undertaken is mainly pulling. The caregiver grasps the Maxislide handles and adopts a walk stance and, using her body weight, pulls the patient gently towards her. Using the principles of normal movement, the caregiver then turns the patient towards the second caregiver using a gentle rolling movement. The patient may need to have her hips, shoulders, and legs repositioned for comfort. Remove both Maxislide sheets from behind the patient rather than the front, as this is where the majority of the slide material ends up following the technique. Maxislides may also be used for lateral transfers. 2 Maxislide sheets are put in place using the unraveling or log roll method. Use an orange tube under the patient's feet if necessary. 2 pull straps are attached to the top Maxislide at shoulders and hips. The pull straps prevent the caregivers from having to overreach. If pull straps are not available, pillowcases may be used. Although not necessary in all lateral transfers, a slide board may be used. While one caregiver rolls or tilts the patient towards them, the other caregiver places a slide board on the bed and slide it underneath the Maxislide sheets. The stretcher is brought into place. It is important to ensure that the stretcher and the bed are of approximate equal height. It will assist with the maneuver if the surface the patient is being transferred onto is slightly lower than the bed. Make sure the bed and stretcher casters are solidly locked. The caregiver on the pulling side grasps the pull straps. The caregiver on the pushing side will assist with initiating the transfer, taking care not to overstretch. Using clear commands and working as a team, the caregiver uses a walk stance and steps back from the stretcher, using her body weight to move the patient. Final repositioning in the center of the stretcher is achieved by using the handles on the Maxislide. Remove both slide sheets to complete the move. The Maxi tube can also be used for lateral transfer if needed. The first caregiver log rolls the patient toward them, while the slide board and Maxi tube is placed under the patient by the second caregiver. There may be situations where a third caregiver may be needed to assist with the feet. The first caregiver begins the transfer by pushing, while the receiving caregiver concludes the move by pulling the draw sheet to the finish position. If you find a patient on the floor, always ensure the correct health checks have been made prior to attempting to move her. If the patient is assessed as safe to move, this technique can be used to maneuver her into a space where a lift can be used. Place a pillow under the patient's head. Using 2 Maxislide sheets and the unraveling technique, place the sheets beneath the patient, ensuring they have been positioned beneath the pillow. This will protect the patient's head during the movement. If space allows, attaching the pull straps will enable you to stand and work in a healthy posture. If you require moving the patient over a greater distance, you can reposition the lower Maxislide in front of the direction of travel. The Maxislide, Maxi tube, and Maxi transfer can be wiped clean using either a chlorine-based solution up to 10,000 parts per milliliter or an alcohol-based solution up to 70% or any good quality sterilization solution. In addition, they can be washed at a maximum temperature of 80 degrees Celsius, 175 degrees Fahrenheit, and drip dried. If necessary, a low-temperature tumble dry can reduce drying times. However, the sliding sheets may develop a wrinkled appearance, which should not affect performance. Maxi tube and Maxi transfer are always packed away or hung up after use in order to prevent people accidentally slipping on them. The Maxislide, Maxi tube, and Maxi transfer are not designed to be left directly under the patient. However, in the case where there is a need for a long-term patient positioning in bed, it may be possible, based on a clinical evaluation of the patient and using an interface such as a cotton sheet, to leave the product under the patient.